Break a leg and everybody's going to be rushing you to the hospital. But have an emotional breakdown and no one really cares. Why? There is a lack of awareness over mental health in our country, to such a degree that those suffering from mental health problems are very often stigmatized and even labeled as crazy. Mental health disorders can range from common conditions like depression and anxiety to less discussed ones like bipolar disorder and schizophrenia. In Bangladesh, these issues often go unnoticed and untreated. There is only one psychiatrist per million people in Bangladesh, underscoring a critical gap in mental health care access. Regrettably, this shows us how the importance of mental health is disregarded. There is a 91% treatment gap, and this is unlikely to be filled unless we find new ways of addressing mental illness. Imagine in a country of over 160 million, a vast majority lack access to adequate mental health care. This is no small issue. And to address this issue, the government introduced the Mental Health Act of 2018. This was a progressive step, but it still needs significant improvement to protect and empower those affected by mental health disorders. For example, this act still enforces that mental illness is a medical condition that can only be treated through medication. Such a stance ignores the benefits of counseling, a pillar of mental health support. This calls for a critical evaluation and reshaping of our mental health legislation. Initiatives like the BRAC Paracounselor model show promise by providing community-based support. This model involves training community members to provide basic mental health support and counseling, and by doing so, it enhances accessibility to mental health services while reducing stigma. What can we do differently? We need to integrate mental health care into our primary healthcare system, ensuring that it is as accessible as physical healthcare. Mental health in Bangladesh is more than just statistics. It's about real people facing everyday struggles, often in silence due to stigma and a lack of resources. It's time we break these barriers and open conversations about mental health, rather than wait for a crisis to acknowledge this silent struggle. Mental health is as important as physical health, and as a nation, it is time we recognize and address this issue. So what is your take on the matter? Comment below and let us know, and follow Cablegram for more.